For decades, Canada treated pharmaceuticals as a market problem, managed through pricing discipline, contracts, and cross-border supply efficiency. That approach worked as long as the system remained predictable. But repeated shortages over the first half of the 2020s exposed a deeper vulnerability. Access to essential medicines had become a question of national reliability. Quietly, without public confrontation or headline announcements, Canada began rebuilding how drugs are sourced, negotiated, and secured. By the end of 2025, that rebuild had evolved into a coherent system designed to reduce single-supplier exposure and strengthen bargaining leverage. The shift did not provoke public disputes, but it did prompt a reassessment inside Washington of assumptions that had long been treated as structurally permanent. Welcome to GEOCAPITALIST, where global power is examined through infrastructure, supply systems, and long-term economic design. Today's analysis looks at how Canada's drug supply rebuild is forcing a rethink in Washington, not through confrontation, but through institutional planning that reached a critical stage by the end of 2025. This is a structural story about leverage, reliability, and how strategic goods reshape relationships when efficiency alone is no longer sufficient. Pharmaceutical supply became strategic infrastructure when governments recognized that its failure produces cascading effects far beyond healthcare. Medicines underpin hospital capacity, workforce participation, and long-term treatment continuity, making their reliability a prerequisite for broader economic stability. Unlike ordinary consumer goods, shortages cannot be quickly absorbed or substituted without systemic cost. As a result, drug availability increasingly resembles other protected systems such as electricity grids, transportation networks, or food logistics, where continuity outweighs short-term efficiency. This reframing changes the role of the state. Instead of acting only as a price negotiator, government becomes a system designer responsible for reducing fragility, coordinating redundancy, and aligning incentives across suppliers. Markets remain involved, but they operate within a framework that prioritizes reliability under stress. Once pharmaceuticals are treated as infrastructure, policy decisions extend beyond cost containment to include diversification, stock planning, and institutional coordination. This shift explains why drug supply now carries strategic weight and why adjustments in its design influence leverage, trade relationships, and long-horizon planning across borders. By late 2025, Canada had quietly assembled the institutional foundations required to redesign how pharmaceuticals are purchased and secured. Rather than announcing a single reform, policymakers layered several mechanisms that reinforced one another. Centralized purchasing capacity was expanded to aggregate demand across jurisdictions, strengthening negotiating leverage and improving visibility into national needs. Shortage monitoring and prioritization frameworks clarified which medicines carried the highest systemic risk, allowing procurement and inventory decisions to focus on continuity rather than price alone. At the same time, procurement policy began emphasizing reliability, reciprocity, and long-term supply commitments, reducing exposure to opportunistic or fragile sourcing. None of these tools were radical in isolation. Their significance lay in how they interacted. Central purchasing created leverage, prioritization defined where that leverage mattered most, and procurement rules translated both into enforceable contracts. Together, they formed a coherent architecture capable of influencing supplier behavior without direct intervention. This foundation marked a departure from fragmented, reactive management toward deliberate system design. By the end of 2025, Canada possessed not just policies, but an operating framework that could support diversification, predictability, and bargaining power at scale, setting the conditions for strategic consequences beyond the health sector, and broader continental planning implications emerged. Canada's drug supply rebuild moved from policy design to strategic consequence when its buyer-side architecture began altering leverage across North America. By aggregating demand nationally, Canada reduced fragmentation that once favored suppliers and replaced it with predictable, system-wide purchasing signals. This did not exclude U.S.-based manufacturers, but it changed the conditions under which they engaged. Continuity requirements, prioritization of critical medicines, and longer planning horizons shifted negotiations away from episodic price concessions toward structural reliability. For policymakers in Washington, this mattered because it challenged an implicit assumption of asymmetry within an integrated continental market. Canada was no longer simply adapting to U.S.-centered supply structures, it was reshaping its role within them. That recalibration forces a rethink about how parallel resilience strategies interact. If buyers strengthen leverage without abandoning open markets, supplier dominance becomes less automatic and coordination more complex. The result is not conflict but adjustment. Washington's reassessment reflects recognition that integrated systems can evolve internally, redistributing influence through institutional design rather than political dispute. In this environment, Canada's approach demonstrates how buyer institutions, not tariffs or bans, can quietly rebalance continental supply relationships while preserving cooperation, predictability, and regulatory compatibility over time across integrated markets and allied systems. Canada's drug supply rebuild is often misunderstood because it does not resemble the industrial policies of the past. It is not an attempt to isolate the domestic market, nor a rejection of international suppliers. U.S. and European manufacturers continue to play a central role, and cross-border trade remains fundamental to availability and innovation. The rebuild also does not involve state ownership of production or emergency-style controls. Instead, it is a redesign of the rules that shape how supply is secured over time. By redefining procurement priorities, consolidating demand, and identifying medicines where continuity is non-negotiable, Canada has shifted from a reactive buyer to a system planner. This approach accepts global production realities while reducing exposure to fragility at key points in the chain. The emphasis is on redundancy rather than replacement, predictability rather than speed, and contractual durability rather than spot market efficiency. Markets still function, but within boundaries that reward reliability and long-term commitment. This distinction matters because it explains why the rebuild has proceeded quietly. There is no single moment of rupture to announce. Instead, the system changes incrementally as incentives, expectations, and bargaining positions adjust. The result is a supply framework that remains open but no longer passive, and that can absorb stress without immediate crisis management. The strategic impact of Canada's drug supply rebuild becomes clearer when financial commitment is considered alongside institutional design. Federal investment in pharmaceutical resilience has not taken the form of a single headline program, but cumulative commitments that now reach into the low to mid-billions of dollars. More than $2.5 billion have been directed toward biomanufacturing and therapeutics capacity, while national pharmacare frameworks introduce multi-billion-dollar purchasing architecture that consolidates demand over time. This spending is reinforced by ongoing federal health budgets that support shortage monitoring, regulatory capacity, and coordinated procurement through institutions such as Health Canada. The significance of these figures is not scale alone, but intent. They anchor buyer-side leverage in durable funding rather than temporary policy signals. For policymakers in Washington, this matters because it demonstrates how sustained investment allows a buyer to reshape negotiation dynamics without protectionism. When financial commitment underwrites system design, leverage shifts quietly but persistently, altering expectations across an integrated continental supply chain. Washington's response to Canada's drug supply rebuild has not taken the form of public disagreement or formal policy rebuttal. Instead, it has unfolded as a quiet reassessment within agencies responsible for health security, trade, and industrial planning. The core issue is not access, but assumption. For decades, North American pharmaceutical supply operated on the premise that integration naturally produced stability and that buyer-side fragmentation posed little strategic risk. Canada's shift challenges that premise by demonstrating how coordinated purchasing and reliability-focused design can alter outcomes without disrupting markets. For policymakers in Washington, this raises practical questions about parallel resilience strategies. If buyers strengthen leverage through institutional architecture, supplier dominance becomes less automatic, and coordination requires more deliberate alignment. This does not imply confrontation, but it does complicate planning. U.S. initiatives to encourage domestic manufacturing and accelerate regulatory pathways increasingly operate alongside, rather than above, allied systems pursuing their own resilience. The rethink underway reflects recognition that integrated supply chains are no longer neutral by default. They are shaped by design choices on both sides of the transaction. Canada's approach underscores how buyer institutions can influence continental dynamics, prompting Washington to recalibrate expectations about how reliability, leverage, and cooperation interact in a more constrained global environment. The durability of Canada's drug supply rebuild lies in how deeply it is embedded within institutional processes rather than political cycles. Once procurement rules, purchasing architectures, and prioritization frameworks are operational, they tend to persist because reversing them introduces risk rather than relief. Hospitals, suppliers, and regulators begin planning around predictable structures, and contracts reward continuity over opportunistic behavior. This creates inertia by design. The rebuild also aligns with fiscal logic. Coordinated purchasing and clearer prioritization reduce emergency spending, last-minute substitutions, and crisis management costs, making the system easier to defend during budget reviews. Importantly, the framework does not rely on exceptional measures. It functions through ordinary governance mechanisms such as procurement standards, regulatory oversight, and long-term planning assumptions. That makes it resilient to leadership changes and shifting political narratives. Over time, the system reinforces itself as data improves, supplier behavior adjusts, and planning horizons extend. What began as a response to fragility becomes a baseline expectation of reliability. This is why the rebuild is unlikely to be reversed or abandoned. It does not depend on urgency to justify itself. Instead, it becomes part of how the state routinely manages strategic goods, ensuring that pharmaceuticals are treated as a permanent element of national infrastructure rather than a temporary policy concern. Canada's drug supply rebuild carries implications beyond pharmaceuticals because it illustrates a broader shift in how strategic goods are governed. The underlying logic, treating essential inputs as systems requiring coordination, redundancy, and buyer-side design, applies equally to energy, food, and critical industrial materials. In each case, reliance on market efficiency alone has proven insufficient under stress. The lesson is not that markets fail, but that they require institutional scaffolding when continuity becomes a strategic priority. Canada's approach shows how this scaffolding can be constructed without isolation, confrontation, or abrupt disruption. By focusing on procurement design, prioritization, and long-term planning, governments can influence outcomes quietly while remaining integrated within larger trade networks. This signals a maturation in economic governance, where resilience is built through structure rather than spectacle. For allied economies navigating similar constraints, the model demonstrates that leverage does not always come from scale or dominance, but from coordination and patience. As strategic goods increasingly shape economic security, the countries that design systems capable of absorbing stress without crisis will quietly define the contours of cooperation and competition in the years ahead. Canada's drug supply rebuild is neither loud nor confrontational, and it was never designed to be. It reflects a broader recognition that reliability has become as important as efficiency in managing strategic goods. By consolidating purchasing power, embedding continuity into procurement, and planning for stress rather than equilibrium, Canada has reshaped how medicines are secured without abandoning open markets. The result is not isolation, but a quieter form of leverage built through institutional design. For policymakers in Washington, the significance lies not in immediate disruption, but in precedent. When buyers coordinate and plan collectively, integrated systems begin to evolve from within. In an era defined by constraint rather than abundance, the ability to design durable systems may matter more than speed, scale, or visibility. And there you have it. If you found this breakdown valuable, watch our next video. And don't forget to subscribe. Your support helps us decode these global shifts without compromise. This is how Canada's drug supply rebuild is forcing a rethink in Washington. Thanks for watching, and we'll see you in the next video.